We discuss Yang deficiency under diagnosis according to 8 principles. When there is Yang deficiency, the body's fundamental warming, activating, and energizing aspect is weak. This will manifest as tiredness, feeling cold, and lacking motivation. The person will be mentally and physically lethargic. Their body movements will be slow and limp, and they will possibly drag their feet slightly when walking. The deficient yang will fail to lift the body upwards and counter gravity. This means that the person might be slightly slouched or that they will have a poor posture, the upper part of the body being slumped forward. A person who is yang deficient will need to wear warmer clothes than other people in order to keep warm. They will typically have cold limbs. The lack of heat in the body will manifest with a preference for hot food and beverages. Their face will typically have a pale color due to the lack of warmth and because yang qi is not strong enough to send blood up to the head. Transformation and transportation of fluids in the body will be impaired when there is yang deficiency and yang is not capable of performing its functions. This will result in there being an increased volume of urine, which is clear in color. There will be frequent urination because of the increased volume of urine and because kidney yang is too weak to keep the urine inside the urinary bladder. Yang qi also helps to keep the sweat inside the body. Yang deficiency can therefore manifest with spontaneous sweating or sweating on light activity. The disruption of fluid physiology will also be seen in a lack of thirst, and there can be a tendency to edema. Yang is utilized in transformation of food that has been ingested. If yang is deficient, the person may have not only loose stools, which is typical of qi deficiency, but also watery stools, possibly containing undigested food particles. This is because the food and liquids consumed have not been transformed. Tongue will be swollen and pale, and pulse will be deep and weak. The organs most likely to be yang deficient are kidney, spleen, and heart. There will be tangible symptoms and signs that specifically relate to these organs' active functions if they are yang deficient. Yang deficiency can arise when yang has been overstrained through prolonged overexertion, old age, recurring cold invasions, improper diet, disease, or congenital weakness. Symptoms and signs are feeling cold or aversion to cold, cold limbs, frequent urination, clear and copious amounts of urine, edema, loose watery stools, possibly containing undigested food, mental and physical fatigue, slow and lethargic body movements, slumped posture, spontaneous sweating, lack of thirst, preference for hot drinks and hot food, pale white face, pale swollen and possibly wet tongue, deep or weak pulse. Key symptoms: aversion to cold, fatigue, pale and swollen tongue, deep or weak pulse. Treatment principle: tonify and warm yang. We choose from the following acupuncture points: Do4, bladder 23, Ren4, Ren6, kidney 3, and kidney 7. Needling technique is tonifying, moxa recommended. Bladder 23, Do4, Ren4, Ren6, kidney 3, and kidney 7, tonify and warm kidney yang. A person who is yang deficient should consume a diet that is warm, both in its physical temperature and energetic dynamic. They should try to avoid completely food that has a cooling quality, including food and beverages that are physically cold. This is especially relevant during the winter. This means that they should avoid fruit unless it is stewed or baked and have no salads, raw vegetables, or cold drinks. They should try to use more warming cooking methods such as baked and grilled dishes. A good start to the day would be to eat hot porridge with a sprinkling of cinnamon. Hot spices such as chili and cayenne pepper are not necessarily a good idea, though, as they will cause the person to sweat and thereby lose heat and yang qi. Replenishing a deficient condition is something that takes time and cannot be forced. Generally, spices in the diet will be beneficial as they will awaken yang. Exercise is important, but care must be taken. Light exercise is beneficial when there is yang deficiency because it will activate yang and qi. However, the person must be careful that they do not train too hard. Otherwise, they will consume their yang qi. Starting the day with activities that can awaken and get qi moving, such as stretching and shaking the body, is a good idea. Keeping warm is important, especially the lumbar area and the area just below the navel. Something that can be recommended is for the patient to wear a woolen belly warmer. Alternatively, they can tie a scarf or a shawl around their abdomen. No matter what, they should try to avoid these areas becoming exposed to the cold or drops. A ginger or mustard foot bath is also something that can be recommended. It will also be beneficial for them to drink ginger tea during the day. Patients who are kidney yang deficient should avoid activities that weaken the kidneys and weaken yang. Apart from the general advice given, men should avoid having too much sex, including masturbation, because yang is expended in the ejaculation and because the semen contains jing, which in the end is the root of kidney yang. Lifting heavy objects weakens kidney yang, so this should be avoided as much as possible. So let us now take note of the difference between excess conditions and deficiency and deficient conditions. Excess conditions, the pathogenic qi is present or there is stagnation of qi, blood, or qinye, can be either acute or chronic, overactivity, or a stagnation of an organ's qi or a vital substance. If there is fatigue, it will be relieved by activity. Symptoms often improve with physical activity. The symptoms are severe, the pulse is strong. Under deficient conditions, there will be deficiency of qi, blood, qinye, yin, or yang. And deficiency conditions are usually chronic, lower level of functional activity in an organ or of a vital substance. Fatigue, exacerbated by activity, symptoms often worsen with physical activity and when the person is tired. Symptoms are milder, pulse is weak. Excess conditions will have thick tongue coating. There will be pain or discomfort exacerbated by palpation and loud voice. While in deficient conditions, the tongue coating is normal or lack of tongue coating. Pain and discomfort relieved by palpation and the voice is weak. Thank you for your attention.